Welcome, Empower You providers. We're so glad you're here for Documentation 101. Intro to Documentation, a foundational training designed to support your work, protect your practice, and elevate the care you provide. Whether you're new to documentation or refining your approach, this session is built to meet you where you are. We'll walk through the essentials of trauma-informed, strengths-based documentation and explore how your notes can do more than meet compliance. They can tell a story of resilience, progress, and partnership. What to expect today? A clear breakdown of what documentation is, and what it isn't. Practical strategies for writing notes that reflect your clinical intent and protect your role. Tips for aligning your documentation with Empower You's values, transparency, collaboration, and client-centered care. Let's start by highlighting why documentation is crucial in healthcare. There's an important saying we often hear: if it isn't documented, it didn't happen. This phrase underscores the necessity of good documentation to provide evidence that Empower You services reflect our core values. Good documentation isn't just a formality, it's a requirement from both Empower You and the children's system of care. Clinicians have both a legal and ethical duty to maintain accurate documentation for each treatment episode. This practice is not only about legality, it's an ethical mandate, a legal necessity, and a guide for effective practice. It ensures that providers adhere to the standards set by regulatory bodies and that our practice decisions are well documented and defensible. Furthermore, documentation facilitates effective communication among professionals and serves as a critical data source for responding to any ethical or legal challenges that may arise. Documenting effectively helps us maintain the trust and integrity essential in the healthcare profession. Today, let's explore the concept of documentation. It's more than just a record, it's a cornerstone of effective practice in the mental health field. First, think of documentation as a reflection of the standard of care. It's about not only what we do but also ensuring providers are qualified for those actions. This dual aspect is crucial. Documentation is also vital for professional communication. It allows us to share meaningful information about client treatment, ensuring everyone involved is on the same page. This exchange is not just beneficial, it's essential. From a legal and ethical perspective, as outlined in the IICBA Code of Ethics, documentation must be sufficient, accurate, and timely. It's our professional responsibility to ensure records truly reflect the client's progress and services provided. Remember, whether written, digital, audio, or visual, documentation is about maintaining integrity and transparency in our practice. It's a key part of delivering and continuing quality care. Let's delve into the vital role of documentation as a legal record of care. Firstly, documentation must be accurate, timely, and compliant. This isn't just about keeping records, it's about safeguarding both the provider and the client. Key legal functions include proof of service, ensuring that what we bill reflects the services provided. This is crucial for both ethical practice and protecting against liability. Now, let's talk about risk management. Documentation serves as a protective measure during audits or investigations. Imagine it as a shield that defends against potential legal issues. Use a hand gesture to illustrate a shield. Court-ready records are essential. Notes can be subpoenaed for custody cases, child welfare hearings, or even criminal proceedings. Ensuring they are thorough and precise is not just good practice, it's a necessity. In terms of regulatory compliance, we have to align with IICBA, state licensing boards, and agency protocols. This means we are upholding the highest standards for confidentiality and security. Pause to let this sink in. Now, let's consider some legal best practices. Writing objectively is key. Stick to observable facts. Complete notes in a timely manner, ideally within 24 to 72 hours, and ensure accuracy without resorting to copy-pasting. These practices help maintain the integrity and reliability of our records. Finally, confidentiality is paramount. Use secure systems and be mindful of not unnecessarily identifying third parties. By adhering to these practices, we not only protect ourselves legally but also enhance the quality of care we provide. Thank you. End with a confident nod. Let's delve into the ethical aspects of documentation. First and foremost, ethical documentation is about respect, transparency, and cultural humility. This means honoring the client's dignity by using non-judgmental and strengths-based language. It's crucial that clients are informed about how their information will be used and stored. This is the essence of informed consent. Transparency is key. Our notes must accurately reflect what actually happened during sessions, not what we wish had occurred. They should also be culturally sensitive, avoiding assumptions and instead reflecting the client's voice and context. Now, let's cover some best practices. Using trauma-informed language is vital. Say, client expressed fear, instead of, client was irrational. This reflects empathy and understanding. Documenting client autonomy is equally important. Highlight their choices and preferences to show collaborative planning. Lastly, be mindful of bias. Understand how race, gender, disability, and other factors can influence interpretation. Always document the impact of interventions, not just the behaviors. This approach will ensure that our documentation not only respects our clients but also upholds the ethical standards of our profession. Let's dive into some common pitfalls in documentation that can unintentionally undermine the integrity of our notes, whether clinical, legal, or ethical. We're all here with the best intentions, but recognizing these patterns is key to improving our practice. First up is the use of vague or generic language. For instance, instead of saying, client was upset, we can offer more detail by saying, client appeared tearful and reported feeling overwhelmed after a conflict with their sibling. This approach not only adds specificity but also supports clinical insight and billing. Next, we have the overuse of jargon or acronyms. Phrases like, client engaged in CBT and DBT with good PRN response, can be confusing. Instead, try saying, client practiced cognitive reframing and grounding techniques, reported feeling calmer afterward. This clarity helps everyone involved in care, including families and non-clinical team members. Another pitfall is missing the client's voice. Rather than just stating, discussed coping strategies, include the client's engagement. Client chose to focus on breathing exercises and stated, this helps me feel more in control. This adds depth and personal insight to the documentation. Delayed or retrospective notes are another area of concern. When notes are postponed, memory fades, details can be lost, and legal risks increase. Aim to document within 24 to 72 hours, aligning with agency policies. Finally, we have the lack of measurable outcomes. Instead of saying, client is making progress, provide specifics. Client initiated a safety plan and followed through with 2 coping strategies during a crisis. By addressing these pitfalls, we can enhance the quality and impact of our documentation, ensuring it truly reflects our dedication to effective and ethical care. Let's dive into the different types of documentation used at Empower You. Each document serves a unique purpose and ensures comprehensive, ethical care. Starting with the master intake, this is your welcome mat into Empower You. It includes essential forms like the confidentiality and consent form, ensuring that clients understand and agree to how their information is managed. We also have the authorization for use or disclosure of protected health information, which aligns with IICBA guidelines to protect client privacy. Next type of documentation is the progress note. Session invoice are crucial for tracking client progress and handling financial transactions seamlessly. Then, we have treatment plans, which map out the therapeutic journey, ensuring goals are aligned and progress is measurable. The biopsychosocial (BPS) assessments provide a holistic view of the client's situation, considering biological, psychological, and social factors. Similarly, the CANS assessments, child and adolescent needs and strengths, focus on strengths-based assessment to support youth and family interventions. These documents collectively ensure that we maintain a structured, client-centered approach. They not only uphold our ethical standards but also empower the youth and families we serve by safeguarding their rights and ensuring transparency. We will get into each document type more in depth in the modules that follow. As we delve deeper into each document type, let's take a moment to reflect on the importance of documentation. It's more than just a task. It's a reflection of our values and commitment to ethical care. With that said, there are key takeaways to keep in mind. First, consider clinical integrity. Each note should communicate clearly what happened, why it mattered, and how it aligns with treatment goals. This clarity not only aids treatment but also supports our clients' journeys. Next, think about the legal protection high-quality documentation provides. Timely and accurate notes are crucial for safeguarding both providers and clients during audits and potential legal proceedings. Ethically, the language we use is powerful. Trauma-informed and culturally sensitive documentation honors client dignity and supports healing. Lastly, recognize the systemic impact. Strong documentation practices enhance team coordination, support advocacy efforts, and drive accountability within youth-serving systems. Every note you write is an opportunity to witness resilience, clarify impact, and advocate for healing. As we conclude, I encourage you to reflect. How does your documentation reflect your clinical judgment? How does it support the client's voice, autonomy, and safety? And how does it contribute to the broader system of care? Thank you for your dedication and for writing with purpose. Remember, if you have any questions or need further information, feel free to reach out. Our team is here to support you.